Hello everyone, this is Kelly, your pre-physician assistant student helper, and today I wanted to talk about patient contact and a lot of different ways you can get patient contact, what counts, what doesn't count, how many hours, am I doing enough, what more can I do? These are a lot of questions I hear from the students at Texas A&M, and I figure a lot of y'all probably have the same questions. Now there are some disclaimers I have here, so not every school is going to count every single form. For example, some schools want paid hours, so you have to have a job in healthcare. Other will accept volunteer hours. Other want 500 hours, 200 hours, 1,000 hours. Some of them vary between healthcare experience and patient contact, so I can't stress enough how important it is to research your schools. Go look at these PA schools' websites, and that's going to be the only way you can 100% know that what you're doing is going to benefit you and, be something that will go in your application and counts. The last thing I want for you guys to do is say, well, Kelly said this, and let me tell you, Kelly is trying to get into PA school too. So there's a little difference right there. I am not an expert. I am just working my butt off to try and get to my dream job, my goal, my career. Everything I want is to become a physician assistant, and I feel like I am this close. I'm so close, I can almost touch it. So, what I have done for patient contact is medical mission work. That is not paid. You pay for it yourself. It's a lot of money, but it is absolutely worth it. I've been on 3 medical mission trips. I'm going on my 4th in March. I absolutely love it. I can't tell you how amazing it is to help people who literally have nothing. And, I've learned a lot through these trips. I'm about to go on my 4th medical mission trip, but I've been on public health trips, higher education outreach, humanitarian, Christian, whatever. Basically any type of mission trip there is, I've probably been on it because I love it so much. I've been on 14 total. But it's just something that I'm very passionate about, and has taught me a lot about life and how I live my life and, lead and serve others. So I have about 200 hours of patient contact from these mission trips. That is because I am there taking vital signs, translating from English to Spanish, Spanish to English. I am doing blood sugar checks. I get to listen to lung sounds, heart sounds, give medications such as, I get to explain all the medications, but I also get to give the deworming medication. So a lot of those people have parasites, so we give them albendazole, and it's a lot of hands-on patient contact. So that's the important part. One thing I've learned is that here in the States, if you are doing medical interpreting, such as, being one of those people who speaks another language and is on the other end of a phone involved in patient care, that is not considered patient contact because you are not touching that patient. So while medical interpreting is an amazing experience, that in itself here does not count for the schools that I am looking into. That does not mean it may not count for you. It absolutely counts as healthcare experience. It's something that is amazing on the application, but depending on where you apply, it may not count as patient contact. I volunteered in a clinic called Texas A&M Physicians. It's a low-income clinic that has the residents and fellows from our Texas A&M family. Well, it's like Texas A&M Family Medicine, but all those people are there helping those patients, and they take volunteers. So there I would do vital signs, do a quick medical history, history of present illness, what medications are you on, what are you allergic to. So that is all obviously hands-on. I also did some volunteer work with them where, restocking their cabinets and their supply closet. But, when you look at those hours and you say, okay, I was there for a total of 100 hours over the course of 2 years. I spent 84 hours of my time doing these patient evaluations, patient contact, and then I spent the rest of my time organizing, answering phones, opening doors. That's not patient contact. So you split those hours in half. You don't double dip, you split them. Lastly, I have been I've been working as a patient care tech for over a year now at St. Joseph Hospital. I work in the stroke and cardiac units, and everything I do is hands-on. That's giving patient showers, bed baths, wiping butts, doing vital signs, blood sugar checks, boosting a patient up in bed, helping the nurses, transporting patients. Like, it is all hands-on. And I mean, it's in the title, patient care tech. Like, my job is to facilitate patient care. I like it. Don't necessarily love it. I am reaching my end point of being, happy to wipe butts. Of course I will do it. I have no problem doing that. But, I'm very thankful for this job. I'm thankful for my role. But I feel like I would love to do something else. I'm getting really antsy. I'm getting to that point where it's like, come on, I want to be a PA. That's what I want. But through that job, I have over 1,000 hours of patient contact. So that's what I've done. I want to tell you what else you guys can do and what my friends have done and what has worked for them. Phlebotomy, scribing, EMT, paramedic, CNA, becoming a tech, like, ER tech, any kind of tech, medical assistant. What else are people doing? I feel like those are some big ones. There are also people who do career changes. So maybe you were an OT beforehand, PT, dentist, and you were feeling like what you're doing wasn't fulfilling enough. You wanted to go forward. You wanted to do something that was more holistic with the body. So there are people, who have a lot of amazing years of experience that are coming to be a PA as well. Some schools may not count scribing because you're not touching a patient. You're following a doctor around and typing their notes for them. You are definitely involved in patient care, but you need to look on the website if they count that. If you're going to get your EMT basic or paramedic, the hours that you do education-wise may not count. So, for example, our Blinn EMT course, maybe it's TEEKS. One of the programs here in town, we have 2 of them. You get about 200 hours of hands-on patient contact experience while earning this EMT basic. However, some schools will count those 200 hours of education as patient contact and others won't. So you have to be careful there because, you may say, okay, I'm going to get my EMT basic, but I'm just going to put those hours on my application. I'm going to move forward from there. Some schools may not take those hours, so you definitely have to keep that in mind and, make sure you're making decisions that, that are smart. So if you're going to get an EMT basic, are you going to use this or do you just want it for the hours? If you just want it for the hours, you may want to reconsider that because some schools may not count that. So definitely keep that in mind. Other things that don't count is being a secretary at a medical office, answering phones, receptionist at a medical office. That is amazing healthcare experience, but it's probably not, it's not patient contact. You're not touching anybody. So keep that in mind as well. That's what I can think of right now. A lot of people have trouble finding these patient contact hours, and they ask me, how do I do this? Do I have to have a certification? How are you able to do this? How do I sign up for a medical mission trip? All that stuff. My advice is research, and be very persistent. You network all the time. This is what I do. If I hear the name PA, I run down the hallway, chase him down, say hi, introduce myself. With my job, I did not have a certification, but on the job description, it says that having a CNA certification is very beneficial. So definitely keep that in mind. If you're having trouble finding it or you feel like everywhere you're looking, they want somebody who has a CNA or an MA certification, consider doing that. It's not a bad idea, and, the more certifications you have, I think it couldn't hurt you, put it that way. And a lot of people, especially in Texas, get frustrated because they don't understand why PA schools want this much experience. I'm going to college, I have my grades, like, why do I need this much experience? Well, in other parts of the U.S., there are schools that are asking for 2,000 hours of experience. That's the equivalent of 1 full year of working full-time as a, some sort of healthcare position. So just remember that the PA field was founded on medical corpsmen who had all this experience from the military. They came out already trained as medical professionals. So, they just need some place to, refine and hone the experience they'd already learned and put that someplace else. So I think that's important to understand that the PA profession was based off of people who already had experience. So don't take it for granted and don't think it's not necessary, because it absolutely is. I was worried. My little time clock right here says 10 minutes, and my phone usually shuts me off at 10 minutes, but looks like my iPad's good to go. So yes, PA profession was founded based on people who already had a lot of experience in the medical field. You know, I think that's what makes us so unique and diverse and amazing practitioners, because we do have different backgrounds coming in, and I think that's really important. So, if you have any questions, comments, concerns, please leave them in the comments below. I try to respond to everything on here. Some of y'all have been emailing me, which is great, but I'm going to be real honest. I am not the quickest at responding to emails. I'm working on it. My semester is about to come to an end. We have our Thanksgiving break next week, so I'm happy about that. Have a little break, but I'm trying to keep up. Good luck to everybody. I hope you are all doing amazing at the end of this interview season, as we're, nearing the end. And, April's going to be here before we know it, and that is the next chance to apply. I know I'm already ready. I just finished the first draft of my next personal statement, so we'll see what happens. I'm really excited. I'm feeling very confident. So any topics you guys want me to cover next, please let me know, and I will talk to you soon. Bye!